Today we are going to learn most common types of tachyarrhythmia. First we will see atrial tachyarrhythmias. First disease of atrial fibrillation where RR interval is irregular with absent P waves or fibrillatory P waves. In stable patient we can give esmolol or ibutulide and go for rate and rhythm control. In unstable patient we can do cardioversion, which is synchronized RR cardioversion. We can also give anticoagulation. AFib is the most common risk factor for the stroke. In AFib we also calculate the risk of stroke through Chadwick score. Second is multifocal P waves, where multifocal atrial tachycardia, where 3 or more different types of morphology of P waves is seen, where irregular rhythm is seen. Drug of choice is verapamil. It is associated with COPD and pulmonary. Third ECG, where we can see there are sawtooth appearance with irregular R waves. It is atrial flutter. Management is same as atrial fibrillation, and we can give here cardioversion with 25 to 50 joule, and drug of choice is esmolol or ibutulide. Third ECG of supraventricular tachycardia. The most common type is AVNRT. Ventricular tachycardia associated with narrow QRS is also called as paroxysmal ventricular tachycardia. Here we can do carotid massage sinus, and I give IV adenosine. In unstable patient we do. Now we are going to see tachyarrhythmias due to ventricle, where white QRS is seen. The first graph is of ventricular. This pattern is also like some child has drawn something drawing. We can easily notice this. In stable patient we give IV amiodarone. Drug of choice is lignocaine. In unstable patient we do defibrillation. First we give epinephrine, amiodarone, then lignocaine. This is ventricular fibrillation. Second is ventricular tachycardia. Wide Q and bizarre QRS complex on the ECG pattern. We can easily rule out ventricular tachycardia. This graph is long QT syndrome or polymorphic axis, also known as Torsady point. There are two types of syndromes associated with Roman-Howard syndrome, where no SNHL is seen, and Jervell-Lange-Nielsen, where SNHL is seen. Drug of choice is MgSO4. Drug associated with Torsady point is antiarrhythmics class 1A and class 3 macrolides, where furoquinolines and chloroquines. So these are the most common types of tachyarrhythmias. First we have seen atrial tachyarrhythmias, then we have seen ventricular tachyarrhythmias. In atrial tachyarrhythmias we have seen atrial fibrillation, atrial flutter, MAT and SVT. In ventricular tachyarrhythmias we have seen ventricular fibrillation, ventricular tachycardia and long Q2 syndrome, Torsady point.